The MaineMOM initiative is a statewide effort to expand access to services for pregnant and postpartum people with substance use disorder. The goal is really to give them the support that they need so that they can succeed in their recovery and help them address any barriers that they might be encountering. Patients with substance use disorder experience stigma, but there is no group that experiences more stigma than the pregnant patient. This is a group of folks that is so shunned by society, even shunned by other people with substance use disorder, that I think they feel helpless, they feel alone. If they've been using substances for a long period of time, they may not be connected to the healthcare system. And part of it is really fear. They're thinking, I know I need help, I want to get help, but where do I even begin? I think getting the word out there to other providers that this is a care model that they can deliver is hugely important.
When I was arrested and in jail, that's when I found out I was pregnant with him. The first reaction I had to being introduced to MaineMOM was, oh, I can't do that. I just had been gone to so many doctors and, seen so many counselors and specialists or whatever, just, people to help me. And all it did was just pile things onto my plate rather than take them away. So I was really scared and I was worried. I was like, I can't do this, because that's what I thought MaineMOM was about, was just, here's the resources, now go with it. But it's totally different than that. It takes it much further. It's made recovery something that I don't dread.
I don't really know of anyone else who helps moms in recovery the way we do. Our roles start early on when we first meet the mothers, whatever it is that they need. We also are integrated into a OBGYN office, so all your care is in one place.
All MaineMOM programs, have an MAT or MOUD prescriber. There's a substance use counselor. There's a perinatal provider of some kind. There's a nurse care coordinator who kind of runs the whole thing. And then we also have peer support. So there's at least 5 members of the team, all with unique and different roles, experiences, that can support the mom wherever she's at. People come, from any walk of life, any personal experience. It doesn't have to be that they had a baby. If they had a recent pregnancy and they had a miscarriage or a termination, they're still welcome to enroll in MaineMOM. We want to support them. And the most important sort of reference point I think, is really educating folks in the community that this exists and that we will treat people with respect that they deserve.
These people do care, and they are going to help you. It's not an if or maybe. They are going to help you, and they will help you so that you can help yourself.
They can make it. They can do it. I have seen grit. I have seen feistiness. And for Amanda, I there may have been days in the early on where she just wasn't sure, let alone what this was going to be, but would I be able to parent? Will I be able to bring home my child? And all of us sitting here today is exactly what this program is about. Exactly.
I think we're successful because we understand substance use disorders. And the one thing that, when patients say it to me, it means is incredibly powerful to me is that, you're the first person who treated me like any other pregnant patient. And that's always surprising to me because I'm like, you are any other pregnant patient. You have a treatable chronic disease, which could be depression, it could be diabetes, it could be substance use disorder. Why would we treat you any differently? But I know that it happens. And I read the notes and I see the experiences people have in other settings, and it's heartbreaking.
I feel like MaineMOM has made all the difference in my recovery, in what I'm trying to accomplish. I don't think without it that I would be here right now at all.
We're excited to have anyone join us on the initiative. There's lots of opportunities, I think. Even if people think, I want to do this work, but maybe I'm not super experienced, that's okay. There's clinical support that's available, and we're here to help anyone who's interested in providing the care. I think being able to be part of life-changing events and help people in a way that no one has ever helped them before is incredibly powerful and really rewarding, and I'm just grateful to be able to do it.